I'd like to call Dr. Andrew Bradley to the stage now to speak to us about the preliminary results of an investigation of the impact of bedding type on pathogen load in bedding, udder health and milk quality.
Thank you, Finola, and I'd like to thank the organisation and the organising committee for giving me the opportunity to come here today and share with you the initial findings we have of a survey of the impact of different bedding materials on both milk quality and udder health in the UK. I'd also like to acknowledge my co-workers and particularly other organisations involved, the Dairy Group, Pathogen Vet Group in Cumbria, and also the University of Nottingham. So to give you a little bit of background, why did we actually conduct yet another study to look at bedding and the impact on milk quality and udder health in the UK? This is really driven by the adoption of recycled manure solids as a bedding material within Europe, and particularly within the UK, and from the context that it's actually considered as a Category 2 waste product on farm, and that recycling of that product is only allowed in technical use if it's shown to not pose an unsatisfactory risk to human or animal health. As a result of that, desktop scoping study was conducted in 2013 by ourselves, and that identified that there were a number of gaps in knowledge with respect to potential issues with animal health and human health that needed to be addressed. And that led in 2014 to a study being commissioned and more research being commissioned to actually investigate some of those shortfalls in knowledge as they were perceived. And that study was managed by AHDB in the UK and funded primarily from money from the Welsh Government. So what I'm actually going to do, there were more study aims than I'm going to outline here. I'm actually going to take you really through a number of the key findings of the study rather than addressing any one particular point in detail, because actually we were tasked to assess the presence and in some cases the levels of different key bacteria within bedding and how those actually then may or may not transfer through into bulk milk and then potentially to the consumer, but also to look at the relationship between bedding, bacterial numbers and udder health on a number of farms. And we approached that in a couple of ways. We actually undertook an epidemiological survey of 125 farms in the UK using different bedding materials, either recycled manure solids, sawdust as an organic-based comparator bedding material, and sand as an inorganic bedding material. And then we also conducted a controlled trial in a farm in Cumbria. I'd like to share with you key findings from both of those studies. Firstly, if we consider the farm survey, as I alluded, this was conducted across 125 farms throughout England and Wales, actually 40 using recycled manure solids, 41 using sand, and 44 using sawdust. And they encompassed a range of different farm sizes and also management techniques, parlour types, with actually 6 robotically milked farms included within that data set. We visited, or members of the team visited all of those farms, conducted a questionnaire, and then followed a closely defined SOP for collection of both bulk milk and bedding material, which was collected from cubicles just prior to rebedding. So we were collecting used bedding materials from these farms. And then we looked at a number of different bacterial parameters, from total bacterial count through coliform, streptococcal counts and the likes, but also at some of the key potential food poisoning organisms that may have implications for human health. In terms of the results, what I'd like to share with you particularly is that I think one thing that's important when we interpret these results is we're not actually looking at bedding types per se, but rather bedding managements. And there was significant difference in the ways that these different bedding materials were managed. So, for instance, typically sawdust was applied once or twice daily, recycled manure solids once or twice weekly, or the sand once or twice fortnight or every 2 weeks. So we're actually looking at very different lengths of exposure of these different bedding materials prior to assessing bacterial numbers. So firstly, this is deliberately visual, really to show you the distributions that we saw. And as you might expect, when we looked firstly at the total bacterial counts, we tended to see that the recycled manure beddings grouped to the right of the graph tended to have higher counts, and actually typically did have higher counts across all the different bacterial species. But actually, when we transferred that through to milk, then you can see we don't see that same distribution. So there's a disconnect between the numbers of bacteria present in the bedding material, when we look across all bedding materials, and the bacterial numbers actually present in milk. So whilst in this instance, the bottom 10, 12 farms were bedded on sawdust in terms of the lowest bacterial numbers in the bedding, we can actually see that that wasn't reflected in terms of the bacterial numbers present in bulk milk. Just to visit a couple of the other key pathogen groups, the coliforms, again, a similar distribution as you would expect. Actually, the green bedding, actually the recycled manure to the right, although the farm with the highest count was actually bedded on sawdust. When we look at milk, again, we don't see that same distribution. Consider one of the key food poisoning organisms, and one where there was a significant area of concern, that being Bacillus cereus, and its proclivity to be found in green bedding. That was confirmed with actually the farms clustered strictly to the right in terms of Bacillus cereus counts. But actually the good news was that that did not transfer through into milk, where actually we only found Bacillus cereus present in 4 of the 125 farms. If we consider some of the other food poisoning organisms, in particular we looked for the presence and absence of Yersinia enterocolytica, Salmonella species and Listeria species. Perhaps actually one of the interesting findings here was actually the prevalence of Listeria, primarily monocytogenes, in sand as a bedding material, with actually approaching 2/3 of farms being actually positive for Listeria in sand. But again, we didn't find that transfer through into bulk milk, where we saw no significant difference between the different bedding materials in terms of actually either presence or absence of those organisms in bulk milk. We looked at udder health, and what we could see here again was no relationship between bedding type and bulk milk somatic cell count, or actually in change. Because it's a relatively new technology, what we looked at was the change in the rate of new infection in lactation, as measured by somatic cell count in this case, and how that changed from the year prior to use of recycled manure solids and the year of use of recycled manure solids. And again, we could find no relationship, no deterioration in udder health as measured by somatic cell count across these farms associated with a switch to the use of recycled manure solids. But I think we need to stress here that, of course, that group of farms using recycled manure solids were a self-selecting population of successful users. There are undoubtedly farms that try to use recycled manure that then fail. I also briefly just like to share with you the findings of the controlled pile, because of course there are many different management factors across those different farms in the epidemiological survey, and that perhaps doesn't reflect the absolute risk. So we conducted a trial at Newton Farm in the northwest of the UK, where we actually took a herd, split that herd into 4 groups of 40 cows, and rotated them in 2-week periods around 4 different bedding materials on cubicles bedded either with deep RMS, shallow RMS, deep sand, or shallow sawdust. As you can see, to reflect what we found in the survey, the RMS was replaced twice weekly, the sand once every 2 weeks, and the sawdust daily. And we rotated these animals around for 2 cycles. We actually collected fresh and used bedding samples on a 2-weekly basis, and we sampled the bulk milk actually with an inline sampler on a weekly basis to determine bacterial numbers in milk. We monitored clinical mastitis, and then in our analysis of infection, looked at movement around the 100,000 threshold at the quarter level, and in our analysis allowing for exposure to the previous bedding material to determine risk of new infection. What we found in this component of our overall study was that actually sawdust bedded, that the cows bedded on sawdust were the least likely and was significantly less likely to develop a new intramammary infection in the 2-week periods compared to the other bedding materials, although they were not significantly different from cows bedded on shallow recycled manure solids. And when we actually looked at the rates of new infection across those 8 2-week blocks as the cows cycled round, we didn't see any significant difference, although there was a strong trend again for lower rates of infection in the sawdust-bedded cows. Finally, we also looked at clinical mastitis at Newton Rig during the study period. Here, really not expecting to find any differences because the study wasn't sufficiently powered of sufficient duration to find anything. But that said, you'll note here It's reported in the literature, and anecdotally, there's an increase in Klebsiella mastitis associated with the use of recycled manure solids, and that certainly came through in this study. There were only 10 cases of clinical mastitis during the study period. Half of those were associated with a Klebsiella species, and actually 7 of the 9 new cases that occurred actually occurred in cows while they were on the recycled manure solids. So I think there are still uncertainties about the risks associated with recycled manure solids, and particularly Klebsiella mastitis, and that bears out what's been seen elsewhere. So in terms of conclusions and mitigating those risks, I think if we consider bed management and recycled manure solids, with the exception of actually managing these beds on deep or shallow basis, we couldn't find any factors that influence the bacterial counts in the bedding. In terms of impacts of bedding conditioners, again, we could find no impact in the epidemiological survey of the use of a conditioner in reducing bacterial numbers. And we found no consistent relationship between the frequency of bedding and bacterial counts. If we looked across all the 3 different bedding materials and actually considered the impact on bulk milk, then again, across all the bedding types, we found no obvious correlations, no relationship between the bacterial numbers in the bedding and those in bulk milk. That said, fore-milking was associated with lower TBCs, pre-milking teat disinfection with lower streptococcus counts, and cluster disinfection was associated with lower thermophilic and psychotrophic counts. There were effects and impacts within recycled manure solids, where we actually found that pre-dipping was associated with a significantly lower bulk milk somatic cell count than herds that did not pre-milking teat disinfect. So in conclusion, our data would suggest that there need not be a relationship between bacterial numbers in bedding and in bulk milk, or the number of bacteria in bedding and actually udder health. That's not to say there isn't a relationship, but to suggest that those farmers that choose different bedding materials adapt their management techniques to ensure they minimize those risks. It would appear that management can go some way towards mitigating bacterial numbers present in bedding and those that reach bulk milk, because when we looked within the controlled trial, we did see differences in the bacterial numbers reaching bulk milk, but that reflects the fact that we had got the same teat preparation technique being used across different bedding materials. And finally, the use of fresh RMS as a bedding material need not necessarily be associated with any decrease in milk quality or udder health, again caveated by the fact that actually we're looking at a self-selecting population of successful RMS users, although it may be associated with an increase in the risk of Klebsiella mastitis, and that needs investigating in the UK environment in a larger study. Thank you.
Thank you, Andrew. Time for one quick question, if there is. Okay. I'm conscious that we're running a little bit behind time, so if there are any burning questions, I'm sure Andrew will be happy to discuss them later.
Okay. For sure.
In a social setting. Thank you very much.